Hello, this is Irvin Eisenberg coming to you from Resilience Occupational Therapy. Here's another video for the series on back pain. Now, often when our backs hurt, we just stiffen up and we don't really want to move at all because we're afraid of that pain. Back pain can be really frightening. It's important to try to keep your mobility going. Now, if any of the things that I recommend here start to really hurt, don't do them. Seek professional assistance for this. I'm not trying to do anything that could further irritate your back. However, there is a little sort of sweet spot of if it's starting to hurt just a little bit, you back off, but you explore where that is, and you go up to that line and back off again. So there are three types of movements that might irritate your back, and it's important to know which ones they are for you. We're not going to get into the rotational components right now because that just gets a little bit trickier. But the first one we're doing is just leaning down to touch your toes. If any of this starts to trigger your back pain, as soon as it starts to trigger it, back off, take a deep breath, and back off. And then do it again. Come down, just the beginning of that stretch where it starts to feel like it's giving you an issue, and then back off again. Do that 3 times. If it's getting progressively worse, this is not the exercise for you. If it's actually getting progressively better with each time you reach down, then this is a sign that this is a really good exercise for you. Do everything slowly. You're reaching down. Ooh, it's starting to hurt. It's not actually hurting me. My back's fine at the moment. But it's starting to hurt right here. Come back up. Do it again. Might be able to go further this time. It might not feel as scary. A lot of this is deconditioning the back to that it doesn't have to be a scary, painful thing. So similarly, you can do this with the back bends. If bending back starts to hurt your back, you stop. Make sure you're not hurting it, but bend back a little bit. Okay, if that's hurting me a little bit, I take a breath and I come out of it. If doing it again actually feels easier, then it might be the right exercise. If doing it again makes it hurt more or the same amount, again, might not be the right exercise for me. The third version of this is the side bends. You might find that the first 2 exercises actually didn't really bother your back, even though you have a back that's currently in spasm and giving you problems. It might be a side component. So you can bend to the side and go, oh, it's starting to hurt right here. It's not actually hurting me, as I said, but then you could come back and then give it a try again. And as I said before, if this is getting easier with each repetition, then this is a good exercise for you. And even if you find one spot, do the other spot. If you find that it's tight on one side more than the other, do the other side just to even things out. I won't do these stretches quickly for sure, and I probably would only do them 3 to 5 times and then give it a break. And of course, if it's one time and it's severely uncomfortable, stop. If the second time is more or the same amount of discomfort, definitely stop and discontinue the exercise. But stop after 5, give your back a break, maybe try them again later if this is something that's already seems to be helpful.